One of the most overlooked but critical distinctions between niacin and its designer counterparts NR and NMN lies in their impact, or lack thereof, on blood lipids. Unlike NR and NMN, which primarily aim to raise NAD levels for metabolic or mitochondrial health, niacin has a well-established, clinically proven ability to beneficially modulate lipoproteins, lowering LDL, bad cholesterol, raising HDL, good cholesterol, and reducing triglycerides. These actions have been documented in large, long-term randomized controlled trials, giving niacin an unmatched track record in preventing cardiovascular disease, the leading cause of death worldwide. Niacin's lipid-lowering power is not a side effect of its NAD boosting properties, but a separate, unique pharmacological action driven by its binding to the GPR109A receptor on adipocytes. When niacin engages GPR109A, it reduces hormone-sensitive lipase activity, decreasing free fatty acid release from fat stores. This leads to a reduction in hepatic VLDL synthesis, which in turn lowers plasma triglycerides and LDL cholesterol. Simultaneously, niacin reduces the clearance of ApoAI, the primary protein in HDL, resulting in a consistent, significant increase in HDL levels. These combined effects are unmatched by any other NAD precursor or standard B vitamin. Historically, niacin's lipid benefits were so profound that it became the first widely used cholesterol-lowering drug before statins were introduced. Trials like the Coronary Drug Project in the 1970s demonstrated that niacin therapy reduced heart attacks and overall mortality, a level of cardiovascular outcome evidence no other NAD precursor even approaches today. Despite more recent controversies over combination therapy trials like AMHI and HBS2, Thrive, where adding niacin to statins didn't show incremental benefit, these studies reaffirmed niacin's strong independent effects on LDL, HDL, and triglycerides. In stark contrast, NR and NMN do not engage GPR109A or other receptors that directly influence lipid metabolism. Their primary role is as NAD precursors feeding the salvage pathway, which may improve mitochondrial function or glucose metabolism but has not been shown in any human study to lower LDL, raise HDL, or meaningfully reduce triglycerides. This means that even if NR or NMN improve certain metabolic markers or mitochondrial health, they cannot replicate niacin's well-established capacity to transform lipid profiles, a key mechanism by which niacin reduces atherosclerosis risk. This difference isn't just academic. Cardiovascular disease remains the single biggest cause of death and disability in aging populations worldwide. Even moderate improvements in LDL, HDL, and triglycerides translate into large absolute risk reductions for heart attacks, strokes, and mortality across millions of people. Niacin's proven ability to shift these lipids, especially raising HDL, which few other drugs accomplish meaningfully, makes it a unique and valuable tool in chronic disease prevention, far beyond what NR or NMN can offer. Moreover, niacin's lipid-lowering effects have a systemic impact that goes beyond NAD restoration alone. By modulating lipids, niacin directly alters the substrate for atherosclerosis, the buildup of cholesterol-rich plaques in arteries that leads to heart attacks and strokes. No NAD precursor without lipid activity can fill this niche. While NR and NMN might contribute indirectly to cardiovascular health by reducing inflammation or oxidative stress in animal studies, these benefits remain speculative without human trials showing real-world reductions in cardiovascular events. Therefore, niacin's dual mechanism, NAD replenishment through the Price Handler pathway and potent lipid modulation via GPR109A, positions it as a unique therapeutic with both metabolic and direct anti-atherogenic properties. This combination gives niacin a proven role in reducing cardiovascular morbidity and mortality, a therapeutic niche that NR and NMN cannot replicate or replace. Recognizing this distinction isn't just a matter of setting scientific records straight, it's critical for guiding patient care. For individuals at risk of cardiovascular disease, a population that encompasses the majority of middle-aged and older adults, niacin offers a powerful, evidence-backed intervention. In contrast, while NR and NMN remain promising NAD boosters, they lack both the lipid-modifying properties and the large-scale human outcomes data needed to claim similar cardiovascular benefits.